Defining My Career by Kirsten-Lee ElcoateNS3772AT2. Self-reflection is a crucial aspect of my nursing practice as it allows me to critically assess my performance, identify strengths, and recognise areas for improvement. By reflecting on my experiences, I can continuously enhance my skills and knowledge, which not only contributes to my personal and professional growth, but also improves the quality of care I provide to my patients. Reljic, Pankahar and Fakona, 2019. Through self-reflection, I have gained the ability to take responsibility for my actions and decisions, promoting accountability in patient care. It has helped me build confidence by learning from past experiences and developing strategies to handle similar situations more effectively in the future. Additionally, reflection helps prevent errors, allowing me to identify potential mistakes or near-miss incidents and make necessary changes to my practice to avoid them. Harrison et al., 2021. The Nursing and Midwifery Board of Australia's Standards for Practice emphasise the importance of reflective practice and the need to stay current with relevant skills and knowledge. By using models of reflection to recognise challenges I experienced during my clinical placements, I have been able to focus on targeted areas for improvement and ensure structured development throughout my graduate year. NNBA 2024. During my clinical placements, I've identified several gaps in my practical skills. Specifically, I need to improve in areas such as applying ECG leads and recalling anatomical landmarks, as well as performing comprehensive cardiovascular and respiratory assessments. These skills are essential for patient care, and I am committed to mastering them during my graduate year. I've also realised that I need to deepen my knowledge in areas like ECG interpretation, pharmacology, and blood gas analysis, competencies that are particularly important in emergency and critical care settings. Harrison et al., 2021. By focusing on these areas, I am confident that I will grow into a competent and confident nurse capable of delivering high-quality, safe and effective care to my patients. Identifying my challenges through reflective practice has given me the direction I need to continually improve and excel in my nursing career. Harrison et al., 2021. According to the Nursing and Midwifery Board of Australia 2021, to maintain my registration as a nurse, I must meet the Continuing Professional Development (CPD) standards. This requires me to engage in 20 hours of CPD during the registration period from 1st of June to 31st of May each year. To fulfil this requirement, I've set 2 SMART goals that align with areas I've identified for growth based on my reflections on my professional practice. The first goal I've set is to develop proficiency in electrocardiographic or ECG interpretation by the end of my graduate year. Interpreting ECGs is essential for assessing cardiovascular conditions, especially in emergency or critical care environments. And Christensen, 2024. My aim is to become skilled in ECG interpretation to improve the accuracy and timeliness of my patient assessments. The second goal I've set is to master blood gas analysis interpretation by the end of my graduate year. Accurate interpretation of blood gas results is critical for making informed clinical decisions, especially in critical care situations where fast, precise action can have a significant impact on patient outcomes. Nursing Times, 2022. My goal is to gain expertise in blood gas interpretation, allowing me to perform quicker and more accurate assessments of my patients. Over the next 12 months, I plan to achieve these goals by dedicating at least 1 hour per week to each topic. During this hour, I aim to complete a range of study types, including, but not limited to, online workshops, participating in trainings, reading relevant materials, and practicing through tests and quizzes. I'll also apply my knowledge during shifts, review clinical cases that involve ECGs and blood gas analysis, and seek feedback from my clinical supervisors. Harrison et al. 2021. To help me stay on track, I've created a list of resources to support my study goal, and I'll dedicate at least 1 hour per week to each topic of ECG interpretation and blood gas analysis, focusing on how to apply this knowledge in critical care settings. Harrison et al. 2021. 4 of the resources I plan to use are as follows: the Australian College of Nursing, ACN, ECG Interpretation online course, the Clinical Skills Development Service, CSDS, ECG Rhythm Interpretation online course, Nurse Labs Arterial Blood Gas Analysis Made Easy with Tic-Tac-Toe Method study guide, and the American Thoracic Society's Interpretation of ABGs Clinical Education course. By following this plan, I'm confident that I'll be able to significantly improve my skills in ECG interpretation and blood gas analysis. I'll stay committed to dedicating the necessary time and effort each week, ensuring that I meet my professional development goals by the end of my graduate year. With these new skills, I'll be better equipped to deliver accurate and timely assessments, ultimately benefiting my patients and enhancing my practice as a nurse. Harrison et al. 2021. Over the next 5 years, my goal is to become a specialist nurse in emergency and critical care, and I've identified a few key steps to help get me there. Harrison et al. 2021. First, I know that mastering ECG interpretation is essential for my role. By the end of my graduate year, I want to feel confident in reading and interpreting ECGs. This will be crucial in assessing patients' heart function in emergency situations. I'm planning to complete an online ECG course and practice my skills during clinical practice. I'll also make sure to review cases with my supervisor to get feedback and sharpen my abilities. Cook, O and Pusik, 2020. Another priority is becoming proficient in blood gas analysis. Quick, accurate interpretation of arterial and venous blood gas results is vital in emergent situations, and it's a skill I need to develop. My plan is to dedicate time each week to study blood gas interpretation using online guides and quizzes. I'll also practice during my graduate year and seek feedback from more experienced nurses to ensure I'm on the right track. Muhammad and Abul Latif, 2019. Improving my cardiovascular and respiratory assessment skills is another key focus. These assessments are fundamental in critical care, and I'm committed to mastering these skills. I'll also attend simulation labs to reinforce my knowledge and ensure I'm able to accurately identify heart and lung sounds, as well as apply these skills in practice. Cockrell, 2024. In addition to clinical skills, I'm working on building my knowledge of cardiac and respiratory pharmacology. Understanding medications such as anticoagulants and antiarrhythmics, SABAs and LABAs, is critical in making well-informed patient care decisions. I plan to attend pharmacology workshops and study real patient case studies to deepen my understanding of these medications. Pua et al. 2019. To stay on track, I'll meet my annual CPD requirements by attending workshops, completing online courses, and gaining hands-on experience. I'll make the most of my clinical rotations by working closely with specialists in emergency environments or cardiac and respiratory units and learning as much as I can from them. Having a mentor in these areas will be key to my growth. Harrison et al. 2021. Reflecting on my journey, I see how crucial self-awareness and continuous learning are to my growth as a nurse. Through my CPD and professional development plan, I've set clear goals to specialise in emergency and critical care, focusing on mastering key skills like ECG interpretation and blood gas analysis. Embracing reflective practice helps me identify areas for improvement and guides me towards becoming a more skilled and knowledgeable nurse. With this plan, I'm confident that I'm on track to providing exceptional care and reaching my long-term goals in these specialties.